In this skill, you'll learn to schedule a timely patient procedure, confirm the appointment with the patient, and issue all required instructions. Begin by obtaining from the provider an oral or written order specifying the procedure to be performed.
Hi, may I help you?
Hi, yes, Dr. Walden says I need to have an MRI done of my ankle.
Okay. It's your left ankle?
Yes, and he says it needs to be looked at pretty soon.
Okay. I show here he'd like it scheduled within a week. Our radiology department downstairs performs MRIs,
Okay.
so I'll just need to get some information from you.
Got it.
Verify that you have the right patient and gather the patient demographic and insurance information.
Monique Jones, 5.
Keep in mind that the patient's insurance carrier may require pre-authorization.
And is there a time that works best for you later?
Determine the patient's availability within the time frame the provider has specified.
Afternoon, or I can reschedule at work and come in next Monday morning.
Okay. We'll try for those two time frames. Would you like to take a seat while I talk to radiology?
Yes, thank you.
Make sure the patient can comply with the necessary arrangements. If the procedure will be performed at your facility, record the order in the computerized provider order entry system. If it will be performed elsewhere, contact the facility to schedule the procedure.
This is Claudia from Dr. Walden's office. I'm calling to schedule a left ankle MRI for a patient. We're looking at Thursday afternoon or Monday morning. Do you have something available then?
Have the patient's health record handy. The facility will need the patient's diagnosis and the provider's exact order, including the name and duration of the procedure. Establish the time and date on which the procedure will be performed.
Thursday afternoon at 4? Okay. This is for patient Monique Jones.
Supply the patient's contact and insurance information.
Her phone number is 217-550.
And communicate any special instructions, such as special anesthesia requirements. Inform the facility if the test results are needed urgently.
But given the concern for pathology, Dr. Walden would like the results within 48 hours, if at all possible. Okay, thank you.
Next, notify the patient of the arrangements you've made with the facility.
All right, Monique, I have this ready for you.
Provide this information in writing.
Okay, so I have a left ankle MRI scheduled.
Tell her how to reach the facility and when she's expected for the
The
procedure.
appointment's on Thursday at 4 p.m.
Go over any instructions she must follow to prepare for the test, such as using an enema, not eating or drinking, or avoiding certain foods or medications. Remind the patient to bring a photo ID and her insurance card. If necessary, advise her to pick up the order from your office.
Okay. You'll just need to bring this sheet with you,
Got
a
it.
photo ID, and your insurance card.
Okay, great.
All right. Do you have any questions?
So I can go straight.
Answer questions and make sure the patient understands the necessary preparations and the importance of keeping the appointment. To reinforce those messages, give her the instructions in writing.
Got it.
One more thing. I have a consent for you. This verifies that you understand the procedure. Did Dr. Walden?
A consent form is used to make sure the patient understands the risks, benefits, and alternatives to the procedure. Give the provider a chance to go over this form with the patient and make sure the patient signs it before the procedure begins. Scan the form and upload it into the electronic health record.
If I can think of anything else, I'll give you a call.
Okay.
Thanks.
Document the details of the scheduled procedure in the patient's health record. Legally, it may become important to show that what was ordered was scheduled. Generate a reminder for yourself to check on the results after the appointment date.